The feedback that I've gotten largely from patients over the years that have used broadband light has been that they prefer the treatments because they see, number one, a better result. Number two, the treatments are easier for them to have done. And number three, treatments are faster and quicker. An advantage in treating faster is that you can treat large areas like an entire arm from the shoulder down to a hand in a relatively short period of time, in a matter of really several minutes or so. That allows me to be able to do multiple passes in a reasonable amount of time. Multiple passes has given us a better result, faster results, and a greater degree of overall rejuvenation of the skin.
The BBL treatment is a great anti-aging solution.
It's wonderful to have people remark that I do not look my age. BBL has changed my life completely. I don't know what I would do without it.
People have lots of options for hair removal. For most people, though, the best option is one that is fast and thorough and as comfortable as possible.
I wanted to remove hair on my bikini area. I had tried everything for hair removal, from shaving to waxing to threading, and nothing seemed to work. I had tried another laser prior to ClearScan, and it was very uncomfortable, and the process took a lot longer. And the ClearScan laser was comfortable, and I didn't notice too much pain during. It was mild, as to be expected, and afterwards there was no pain at all.
What I've seen is just, hairs turning under the skin. You can shave every day. Most people say you shave every day. That'll solve the problem. That does not solve the problem. All that does is sometimes make the problem worse.
ClearScan from Sciton is the solution for permanent hair reduction for all skin types, including dark and tanned skin. ClearScan is effective. It delivers the ideal wavelength for permanent hair reduction. It achieves permanent hair reduction through selective targeting of the melanin that's found in hair follicles. Its deep penetrating wavelength and correct pulse width can penetrate to the deepest follicles.
What I've seen is the hair has gone from a very coarse type hair texture to a very fine hair texture. So the hairs turning under aren't as common. They're actually, I don't shave as much. I shaved this morning just because I knew I was going to be sitting in front of a camera, but I probably shave once every other day now. And hopefully I won't have to shave at all soon.
I love the results. I'm very excited. They are exactly what I wanted. I don't have to think about body hair as much anymore, and I went to the beach this summer, didn't have to worry about anything, and I'm really excited about it.
ClearScan is fast. Its technology delivers precise and consistent results. The computer-guided scanner covers large areas rapidly and evenly for maximum reduction in each treatment.
I was really surprised because I thought it was going to be more painful, it was going to take longer, maybe even be some downtime, and there was none of that. It was quick, it was efficient, and it was pretty painless.
ClearScan is designed for patient comfort and safety. With its powerful integrated cooling system, ClearScan gives your physician precise control over cooling, including full skin contact for maximum comfort before, during, and after treatment.
Well, this is the nice part about this treatment. The downtime, I didn't see any real downtime. I would get treatment and I would go right back into the office. There was no pain associated with it. I didn't have to go home and put ice packs on my face. I didn't have to go hide.
There was no healing process. It was just as simple. It was probably even more comfortable than going to get a wax or something. It was more comfortable than that.
Permanent hair reduction requires multiple treatments. Your physician will determine the number of treatments that are right for you. Over the course of your treatments, most hair will be permanently removed. The hair that does regrow will be finer and lighter than before. The ClearScan system can be used on just about any area of the body: the lip, the face and bikini line, the arms, underarms and legs, as well as the back.
If somebody is considering doing the ClearScan laser, I would definitely recommend it and suggest that they do it right away, because the sooner you do it, the quicker results you get.
Do it. Do it. If you have a problem, if you want to get it dealt with, do it. It's the easiest, painless, cost-effective treatment that I've seen, period. And I've tried a lot of them. And I've even bought home products over the internet. They don't work. So I've tried a lot of them. I'd say do it.
Permanent hair reduction for all skin types, including dark and tanned skin. Robotic scanning technology for fast and consistent results. And an integrated full contact cooling system for patient comfort and safety. That's ClearScan from Sciton. Younger looking, healthier feeling skin. Skin that is smoother and more vibrant. It's something we all hope for as we age. Fortunately, there are options that help you get what you're hoping for. Options that can deliver dramatic improvement in wrinkles, scars, and pigment. Options for improved skin tone and texture. Treatments performed by your physician, including microlaser peel, deep resurfacing, pro-fractional therapy, and combination treatments, all made possible by Sciton laser technology.
Well, when I was younger and even into early adulthood, I had acne, and I almost think it was probably worse in my early 20s. And so there was scarring that, made me unhappy, and that was really what I wanted to try and fix and make my skin smoother overall.
It was the spots that troubled me more than anything. And that's how I started.
I looked in the mirror and saw someone 10 years older and knew that that's not the person I really was inside.
I think when people are talking to you or looking at you, they're looking at your eyes, they're looking at your mouth. And for me, I wanted those to be as good as they could be for my age.
Microlaser peel is an intraepidermal laser peel that precisely ablates or removes the outermost layers of the skin. The procedure is individually tailored to each patient and the condition being treated. Sometimes referred to as the weekend peel because of the minimal downtime you can expect, Sciton's microlaser peel will deliver noticeable improvement in a matter of days. Microlaser peel is the perfect solution for anyone looking for more than what can be done with microdermabrasion or a light chemical peel, but who has little time for a prolonged healing process. Another resurfacing solution that delivers dramatic results with little to no downtime is known as pro-fractional therapy, also from Sciton. It is a quick and comfortable fractional laser procedure that can improve the overall appearance of your skin by reducing the appearance of fine lines, while simultaneously improving skin tone and texture. The beauty of the Sciton laser is that your physician has ultimate control and can optimize settings for your individual needs. During a pro-fractional session, thousands of microscopic channels are created in the skin. These channels are left surrounded by untreated skin, leaving the surrounding skin intact, speeds healing and makes the treatment and recovery more comfortable. While the deep channels of treated tissue heal, collagen in the skin is strengthened and remodeled. The body's natural healing process, combined with collagen remodeling, means that superficial imperfections are almost immediately corrected, while the skin's texture and tone will continue to improve weeks and months after treatment. Typically done in a series of 1 to 4 treatment sessions, spaced 3 to 6 weeks apart, healing takes only a few days. Most skin areas can be treated, but the most popular areas are the face, neck, chest, and hands.
The healing was so simple, and that's what I really liked about the process.
You wake up one morning, I swear, and it looks better. Like all of a sudden, it has changed overnight. It's smoother. It was like I could see it working.
Some of my friends who hadn't seen me for a while, it just overall comes like, oh, you look great. You look really well rested. And that's how I felt. I did feel really well rested. And, you know, your skin looks great. What are you doing? And questions like that.
For some people, a combination treatment may be the ideal solution. Again, your physician knows best and can tailor a treatment plan to meet your specific needs and cosmetic goals. With Sciton's technology, your physician has the option to combine a microlaser peel with Profractional, using microlaser peel to remove superficial skin lesions and other irregularities, and then Profractional therapy for deep collagen remodeling. When combination treatments are recommended and performed, you'll not only get better results, but you'll get those results with fewer treatments.
If you can do both of them at one time, I think that's a great way to go.
Do it all at once. It's a great thing. It's a great thing.
Your physician may also recommend deep resurfacing, another solution available from Sciton. The same Sciton system used for microlaser peel treatments can be tuned for deeper resurfacing to improve the skin's appearance, treat mild to deep wrinkles, and reduce scars. The laser used, called Contour TRL, which stands for Tunable Resurfacing Laser, gives your physician the most complete control to optimize treatment for a patient's skin type, desired outcome, and downtime expectations. It's an extremely versatile system and just another tool your physician has to help you achieve the results you seek.
Can you see I'm beaming? I mean, that it is. There's a confidence in my family saw when I walked in the door.
I would do it again. I'd do it in a heartbeat. I think the laser procedure, it's like a miracle.
Laser resurfacing options, microlaser peel, Profractional therapy, deep resurfacing, and combination treatments. Options for smoother, healthier, and more vibrant skin. Options that allow you to look your best. Options from your physician and from Sciton.
My name is Kristen Farrell, and I host a TV show based here in Lake Tahoe. It's a live TV show, and we cover all things Lake Tahoe. So in covering those things, we need to be familiar with them. And it gives me the opportunity to go be outside and enjoy the snow in the winter, and the kayaking and the paddleboarding and the hiking and the biking in the summertime. So it encompasses everything that I love to do outdoors. I am outside all the time. I also have 2 young kids who I have with me all the time who love to be outside too, so I'm chasing them. I was always the one who had to be the most tan. To me, it showed that I had been outside. It was the healthy glow. That's what I perceived it to be. As I got older, into my mid-30s, I started to realize that kind of treatment to my skin started to catch up with me. I started to notice sunspots, a lot more wrinkles, and it definitely showed up more when I was on camera. And so I was having to put on more and more makeup in my daily life and to go do my job, to be on camera. So that's what brought me here, to fix some of that sun damage and to restore a more youthful appearance to my face. I think we're all our own worst critics. We've all looked in the mirror very closely at ourselves, and I surely had many of those mornings where I got up and looked in the mirror, and it was just one day where I said, I cannot look at splotched skin starting to age prematurely because of the sun damage and the damage I had done to it for one more day. And that's what made me pick up the phone and call Dr. Gelber, and we reviewed the options and decided that the Sciton laser resurfacing treatment would be the best, and it absolutely has been fantastic.
Halo has been the best of both worlds. It's the very first hybrid fractional laser, and it allows me to deliver to my patients the results of an ablative procedure with the downtime of a non-ablative procedure. And that is the best of both worlds. So you can decide how much ablation, and you can decide how much coagulation you're going to use. Regardless, you will see a significant improvement in your patient's sun damage. You'll see an improvement in tone and texture. And particularly when you use more ablation, you can actually improve wrinkles. These are all things our patients want, and when you can deliver them with a simple, easy treatment, they'll love it.
It was about day 6 where I was able to look at my skin and go, wow, that is night and day. Literally daily, I get to hear people say, your skin is just beautiful. Right after I did go back to work and I hosted my first show post-treatment, I got compliments. People wrote into the show saying your skin looks amazing. Other hosts of different shows that are taped throughout the day at the TV station came in and said, wow, what did you do? Your skin looks incredible. And I was proud to say, I don't have much makeup on at all. This is exciting. I'm turning 40 this year, and I look forward to maintaining a very active lifestyle that includes being outdoors a lot. And that's why I'm back 1 year later after my first Sciton laser resurfacing treatment. I'm looking forward to seeing what the latest is in technology now and maintaining healthy skin throughout the rest of my life. It feels really, really good to know that I did the right thing for my face and for my job and for my future. Feels good to look in the mirror and see that. I just had the Sciton Halo laser treatment and it was very easy. I was very well cared for and I cannot wait to see the results in a few days. This is exciting.
Cool sculpting targets and cools fat cells to temperatures that trigger their natural death. Importantly, because lipids in fat crystallize faster than normal cells, there is no damage to nerves or other tissue. Over the next few weeks and months, the fat cells shrink and begin to die as the patient's own body metabolizes them and naturally eliminates them. The overall fat layer is significantly reduced, which results in a noticeable and measurable reduction in the fat bulge around the targeted flank.
Meet Joe, an active professional who's on his way to the top. And meet Jane. She's got it going on as well. Just like many of us, they exercise regularly and eat healthy. So what's the problem? That stubborn spare tire and muffin top just aren't coming off. Totally uncool. Well, there's a cool new solution. It's called Cool Sculpting, a patented, clinically proven, FDA-cleared safe procedure that freezes fat cells, but not your skin, so that they naturally go away. Yep, that means no needles, no knives, no downtime, and no worries. Developed by Harvard scientists and offered only by licensed physicians, innovative Cool Sculpting non-surgically targets those fat cells in your body that give you those stubborn lumps and bumps. And with a single visit, you can expect to see an undeniable reduction of fat in just 2 months. Best of all, you can come in during your lunch break, then head back to work in 1 to 2 hours. You've got nothing to lose. Well, except of course those unlovely love handles. Ask your physician for a consultation to see if Cool Sculpting is right for you. Find more information in a center near you at coolsculpting.com. Cool Sculpting. Reclaim the real you.
What if there's a way for you to grab up that extra unwanted fat on your body and just freeze it away?
There is a solution for you. It's called Cool Sculpting.
Cool Sculpting chills the fat cells, destroying them.
Really shocked that it didn't hurt. It just feels like kind of a very cool massage.
Absolutely amazing. I noticed in about 5 weeks, and then it just kept getting better and better.
Something was happening, and I knew my clothes were fitting different, and my husband noticed, and I noticed. But I was even shocked when I saw the before and after photos.
Cool Sculpting only took 1 hour. 1 hour, no general anesthesia, no local anesthesia, no pain. 1 hour, in, out, bing, bang, boom, done. Loved it.
It's been really nice because I feel like I finally have gotten back the body I had 15 years ago when I was in college, and I didn't expect that from the procedure.
After I had Cool Sculpting done and saw the results that I had, I've definitely recommended it to a few people, several people at my gym that have the exact same issues. They work out 7 days a week, but there's still some areas that, regardless of how much they work out, it's not gonna go away.
I feel confident in a two-piece bathing suit. I haven't had a two-piece on in years, and I can walk around with it on. I have a form-fitting dress on, and it just slinks off my body. So when I walk down the street, I feel confident, I feel strong, I feel sexy, I feel beautiful. Cool Sculpting is probably one of the best things that I've ever done.
Meet Noelle. She's taking her little one for a stroll. Like a lot of new moms, she's frustrated with her figure and struggling with that last bit of baby bulge. Luckily, there's a non-surgical procedure that can help moms, or any woman, transform herself. It's called Cool Sculpting, developed by Harvard scientists and offered only by licensed physicians. Cool Sculpting's innovative, non-invasive technology freezes and naturally eliminates fat from the body. This breakthrough procedure can safely eliminate fat with no needles, no special diets, no exercise programs, and no downtime. Best of all, you can have the body you want without altering your entire lifestyle. Ask a Cool Sculpting provider for a consultation to see if Cool Sculpting is right for you. Transform yourself with Cool Sculpting.
Everyone wants to look and feel their best, but no matter how much pain you put into eating healthy and exercise, sometimes there's just no gain. That muffin top and those love handles? It's called stubborn fat for a reason, and it used to be something that most of us had to live with. Until now, thanks to a team of renowned scientists at Massachusetts General Hospital, a teaching affiliate of Harvard Medical School, and the revolutionary procedure called Cool Sculpting. Here's the skinny. Cool Sculpting is a clinically proven non-invasive procedure that freezes fat cells without damage to your skin.
Fat cells are naturally more vulnerable to
cooling than the surrounding tissue. So by delivering prolonged, controlled cooling to an area, you can induce fat cell elimination naturally over time.
As a non-surgical procedure, Cool Sculpting is the perfect fit for people who would normally not consider a cosmetic procedure or don't want the downtime and risks associated with surgery. Cool Sculpting isn't about what you lose, it's about what you gain.
I work out usually 6 or 7 days a week, and no matter how lean I get, there's like some certain problem areas that will just never go away.
Just a little bit of fat that I couldn't exercise away, that no matter, unless I wanted to become a fitness or figure model and do extreme eating, just wasn't going to go away.
Well, so I work a lot of hours, and it impacts me being able to work out as much as I would like to, and Cool Sculpting was an option for me that would give me quick results but have no downtime, so it didn't impact my day-to-day life.
Cool Sculpting takes just 1 hour per treated area. Most patients can rest, check email, or read during the treatment. What about the downtime afterwards? There is none. After their treatment, patients typically return to their daily activities. Some patients may experience redness, minor bruising, numbness, or discomfort in the treated area, but only temporarily.
That through all my working out through years and years and years that I was never able to achieve, and it makes me really happy when I look in the mirror.
So after having Cool Sculpting, I was finally able to get rid of my stubborn fat, and now I feel like I did and look like I did when I was in college.
I look great in my bikini. I can walk on the beach with the utmost confidence.
Feeling and looking good isn't about what you lose, it's about what you gain. Cool Sculpting helps you reclaim the real you.
Cool Sculpting is based upon the research of 2 outstanding Harvard scientists who looked at the observation that cold could be applied non-invasively to remove fat. Cool Sculpting targets and cools fat cells to temperatures that trigger their natural death. Importantly, because lipids in fact crystallize faster than normal cells, there is no damage to nerves or other tissue. Over the next few weeks and months, the fat cells shrink and begin to die as the patient's own body metabolizes them and naturally eliminates them. The overall fat layer is significantly reduced, which results in a noticeable and measurable reduction in the fat bulge around the targeted flank.
The ideal candidates for Cool Sculpting are those people that have stubborn pockets of fat that are resistant to diet and exercise. The love handles, muffin top, so-called spare tire, these are the people that really do best with Cool Sculpting. Cool Sculpting is a quick procedure. Patients can have it performed on their lunch hour and go right back to work.
Only took 1 hour. 1 hour, no general anesthesia, no local anesthesia, no pain. 1 hour, in, out, bing, bang, boom, done. Loved it. Growing up as a classically trained ballet dancer, I'm used to discipline. I'm used to being fit. I'm used to being healthy. With Cool Sculpting, I got the exact results that I wanted. I did a little bit of fat, just a little tiny little fat that no matter what I did, I just couldn't get rid of. And Cool Sculpting let that little bit of extra fat just go away. Bing, bang, boom, done. Loved it. With Cool Sculpting, I was able to have the procedure done. It took about 1 hour, just one little hour. I was up to work and I was at the gym the same day. I feel great. I didn't have any downtime. I'm starting to see that nice little waistline appear, so I'm getting that little hourglass effect going on. I really like that. I have not had a 2-piece bathing suit on in years, and Cool Sculpting gave me the confidence to go out on the beach in a bikini. I haven't done that in years. I feel strong, I feel powerful, I feel confident. I would recommend it to anybody. I'm healthy and I'm loving what I'm seeing with Cool Sculpting. How cool is that?